Hi guys, welcome back for our daily practice questions. It is day 213 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all the resources that I offer. And if you're looking to gain the last spot to the upcoming 5-week intensive review, that link is also in the description. Class runs from August the 11th through September the 12th. All right, question number one states, a 55-year-old woman with type 2 diabetes is diagnosed with stage 1 hypertension. Her labs are normal and urinalysis is negative for protein. Which of the following is the most appropriate initial antihypertensive? Is it A, amlodipine, B, HCTZ, C, lisinopril, or D, metoprolol? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here the stem of the question states, which of the following is the most appropriate initial antihypertensive? So in this situation, typically I tell you if they're looking for a treatment, to look and see if they provide you with a diagnosis. The stem of the question provides all of that. It's telling you we're looking for a first-line antihypertensive, so we know hypertension is the diagnosis. But let's run it back and see what other things have been provided so we can know what route to take for first-line therapy for hypertension management. So we have a 55-year-old woman. She has type 2 diabetes and stage 1 hypertension. So the key here is that she does need renal protection, right? So remember, with renal protection for hypertension management, we're going to go either with an ACE or an ARB. So the best answer here is C, lisinopril. All right, question number two. A 63-year-old male has hypertension and chronic kidney disease. Which of the following is the best first-line treatment? Is it A, chlorothalidone, B, amlodipine, C, valsartan, or D, atenolol? Take a moment and tell me what you got in the comments. All right, stem of the question states, which of the following is the best first-line treatment? So again, you need to run it back and see if they provide you with a diagnosis. And this patient does have hypertension as well as chronic kidney disease. So we're looking for hypertension management for this patient. So again, they will need renal protection because they have CKD. So the best answer is C, valsartan. Remember, sartan, the ending of sartan is an ARB. The ending in pril is an ACE inhibitor. All right, lastly, question number three. A 52-year-old African American female presents for an annual exam. Her blood pressure is consistently elevated on 3 separate visits, averaging 146/94. She has no history of diabetes, kidney disease, or cardiovascular events. According to current guidelines, which of the following is the most appropriate first-line antihypertensive treatment? Is it A, lisinopril, B, amlodipine, C, chlorothalidone, or D, metoprolol? Take a moment and tell me what you got. So stem of the question states, according to current guidelines, which of the following is the most appropriate first-line antihypertensive treatment? All right, so again, it's telling us in the stem that we're managing hypertension. We're looking to see what is the first-line therapy, so you got to run it back and look at the things they provided to you. So we have a 52-year-old African-American female. That alone tells you first-line therapy options already. Because with the African American population, thiazides and calcium channel blocker are our two first-line therapy options, with thiazides being the captain, as long as there's not something that is a contraindication for a thiazide. So then you should be processing that through your mind and walking through to see if there's a reason why you would not give a thiazide. Her blood pressure has consistently been elevated. She doesn't have a history of diabetes, kidney disease, or cardiovascular events, so nothing warranting renal protection, meaning that we would need to use an ACE or an ARB. And then there's nothing that is like an allergy or electrolyte deficit or gout or anything of that nature that's contraindicating a thiazide. So that will be your first line therapy. So C, chlorothalidone will be your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously in the video, my website is also linked in the description of this video, and it houses all of the resources that I offer. It is broken down for first-time test takers as well as those who may be retesting. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.